Can you describe the typical nursing care for a patient undergoing a hysterectomy?
For a patient undergoing a hysterectomy, nursing care is comprehensive and spans the entire surgical journey, from preoperative preparation to postoperative recovery. Before the surgery, my priority is ensuring the patient is both physically and psychologically ready. This involves a thorough assessment of their baseline vital signs, reviewing their medical history for any potential risks, and providing clear, empathetic patient education. I would explain the procedure itself, what to expect in the operating theater and recovery, and the importance of things like pre-surgical fasting and bowel preparation. It is also crucial to address any anxiety or fears they may have, creating a supportive environment, and answering all their questions to the best of my ability. In the immediate postoperative phase, my focus shifts to monitoring and managing recovery. The initial hours are critical for observing for any signs of complications, such as excessive bleeding or a drop in blood pressure, and ensuring adequate pain management. I would assess the surgical site for drainage and signs of infection, and regularly monitor the patient's vital signs and urine output. I would also encourage early ambulation as per the surgeon's orders, as this is vital for preventing postoperative issues like deep vein thrombosis, DVT, and improving bowel function. Patient education continues in this phase, empowering them with knowledge about incision care, dietary restrictions, and warning signs to look out for after discharge. My goal is to facilitate a smooth, safe recovery and ensure the patient feels supported and confident in their care every step of the way.
What are the key signs and symptoms of a ruptured ectopic pregnancy?
The key signs and symptoms of a ruptured ectopic pregnancy are typically characterized by a sudden onset of severe abdominal pain and signs of internal bleeding. The pain is often described as sharp, stabbing, or tearing and is usually localized to one side of the lower abdomen. This is accompanied by a significant and sudden drop in blood pressure, leading to symptoms of hypovolemic shock, such as dizziness, lightheadedness, and fainting. The patient may also experience a rapid, weak pulse and cool, clammy skin. Another critical sign is vaginal bleeding, which can range from light spotting to heavy flow, but is often different from a normal menstrual period. Some patients may also complain of referred pain in the shoulder, which is a classic symptom. This occurs because the internal bleeding irritates the diaphragm, and the pain sensation travels up to the shoulder via the phrenic nerve. I would also anticipate a positive pregnancy test result, as the patient is pregnant, but the location of the embryo is a medical emergency. The combination of these symptoms, severe unilateral abdominal pain, signs of shock, and shoulder pain, would immediately raise my suspicion and trigger an urgent response, as a ruptured ectopic pregnancy requires immediate surgical intervention to prevent life-threatening hemorrhage.
Explain the different types of uterine fibroids and how their location might affect a patient's symptoms.
Uterine fibroids are benign growths that develop from the muscle tissue of the uterus, and their clinical presentation varies significantly depending on their size, number, and crucially, their location. There are 3 primary types based on their position. Submucosal fibroids grow into the uterine cavity, just beneath the inner lining. Even when small, these fibroids can cause significant symptoms, most notably very heavy and prolonged menstrual bleeding, known as menorrhagia. They can also lead to irregular bleeding between periods, anemia due to blood loss, and may interfere with fertility or lead to recurrent miscarriages by distorting the uterine cavity. Next, intramural fibroids are the most common type and grow within the muscular wall of the uterus itself. Their impact largely depends on their size. Smaller intramural fibroids might be asymptomatic, but as they grow larger, they can cause the uterus to enlarge, leading to pelvic pressure or a feeling of fullness. They can also contribute to heavy menstrual bleeding and pain, as their presence within the muscle wall can affect the uterus's ability to contract effectively during menstruation. Finally, subserosal fibroids develop on the outer surface of the uterus, growing outwards into the pelvis. These fibroids often grow quite large before they become symptomatic because they have more space to expand without directly affecting the uterine lining or muscle contractions. When they do cause symptoms, it's typically due to their bulk and the pressure they exert on nearby organs. For example, a large subserosal fibroid pressing on the bladder can lead to frequent urination, while pressure on the rectum can cause constipation or a feeling of rectal fullness. Sometimes these can be pedunculated, meaning they are attached by a stalk, and if they twist, they can cause acute, severe pain. Understanding these distinctions is crucial for accurate diagnosis and tailored patient care.
How would you counsel a patient who has been diagnosed with HPV and is concerned about the risk of cervical cancer?
Navigating a new diagnosis of HPV can be very concerning for a patient, and my first step will be to provide a calm and reassuring environment where she feels safe to express her fears. I will begin by validating her feelings, acknowledging that the link between HPV and cervical cancer is widely known and that her anxiety is completely understandable. My approach would then be to educate her on the facts, which can significantly reduce fear. I would explain that HPV is an extremely common virus, and that in over 90% of cases, the body's immune system clears the infection on its own within 2 years without any intervention. I would then clearly distinguish between having an HPV infection and having cancer. I'd explain that HPV infection is a necessary but not sufficient cause for cervical cancer. It is a long, slow process that takes many years. I would reassure her that the primary reason for a positive test is to simply monitor for any future risk, not to signal an immediate threat. The most important message I would convey is the power of regular cervical screening, such as Pap test and HPV co-testing. I would frame these screenings as her best defense, explaining that they allow us to detect and manage any abnormal cellular changes long before they ever have the chance to develop into cancer. I'd also discuss the benefits of the HPV vaccine as a preventative measure for future infections, if applicable. Finally, I would conclude by emphasizing that she is not alone in this journey and that we are here to support her with ongoing education and a clear, proactive plan to protect her long-term health.
Describe the procedure for a pelvic examination. What are the key points of patient preparation and aftercare?
When a patient requires a pelvic examination, my primary focus is to ensure their dignity, comfort, and understanding throughout the entire process. Before the procedure begins, the key to patient preparation is communication. I would first introduce myself and confirm the patient's identity. I would then provide a clear, easy-to-understand explanation of why the examination is necessary, what it will involve, and how long it will take. It is crucial to obtain their verbal consent and answer any questions they may have, reassuring them that they can ask the clinician to stop at any point. I would then offer them a gown and ensure the room is private, warm, and comfortable. I would instruct them on how to position themselves on the examination table and ensure they are covered with a drape to maintain their privacy. I would remain present to act as a chaperone, a patient advocate, and to assist the clinician as needed. Following the examination, aftercare focuses on both physical and emotional well-being. My first step is to provide a clean towel or wipes for the patient and assist them in getting dressed if they need help. I would offer them a few moments of privacy to do so. Once they are ready, I would check on how they are feeling and provide an opportunity for them to ask any follow-up questions about the procedure itself. I would also reinforce any instructions given by the clinician regarding next steps, such as when to expect test results, and I would provide them with a leaflet or written information to take home. The goal is to ensure the patient leaves feeling respected, informed, and supported, having had a positive and therapeutic experience despite the intimate nature of the examination.
A patient is distressed after receiving a new diagnosis of polycystic ovary syndrome. How would you provide emotional support and education?
Caring for a patient who has just received a diagnosis of polycystic ovary syndrome, PCOS, requires a compassionate and holistic approach that addresses their immediate emotional distress as well as their need for accurate information. My first step would be to sit with the patient in a calm and private setting, using active listening to allow her to express her feelings and fears without interruption. I would validate her emotions by acknowledging that receiving a new diagnosis can be overwhelming and confusing, which helps to build trust and rapport. It's crucial to reassure her that she is not alone and that PCOS is a very common condition affecting millions of women. Once she has had an opportunity to express herself, I would begin the educational component, focusing on clear, easy-to-understand information. I would explain that PCOS is a hormonal and metabolic disorder, not a disease she has to battle alone, and we can manage it together. I would break down the key aspects of the condition, such as irregular periods, acne, or weight gain, and connect her specific symptoms to the diagnosis in a way that makes sense to her. The conversation would then shift to a proactive management plan, highlighting the importance of lifestyle modifications such as diet and exercise, which can significantly improve symptoms. I would also discuss potential medical treatments like hormonal birth control or metformin, explaining how each works. The goal is to empower her with knowledge and a sense of control, turning a moment of distress into a clear path forward. I would end the conversation by providing her with reliable resources, such as a patient information leaflet and links to reputable support groups, to ensure she feels supported long after our conversation ends.
How do you ensure patient privacy and dignity during intimate examinations and procedures?
Ensuring patient privacy and dignity during intimate examinations and procedures is a fundamental aspect of my nursing practice. My approach is rooted in respect and clear communication. Before any procedure, I always explain what is going to happen in a calm and professional manner, using simple language. This includes explaining the purpose of the examination, which parts of the body will be involved, and how long it will take. This level of transparency helps to empower the patient and gives them a sense of control over the situation. I always obtain explicit verbal consent and remind them that they can ask me to stop at any time. Physical privacy is non-negotiable. I ensure the room is completely private by closing doors and curtains, and I make sure the patient is covered with a clean sheet or blanket as much as possible, exposing only the area being examined. I always offer a clean gown and give them time to change in private. During the examination, I act as a professional chaperone, which is crucial for patient safety and comfort. I stay present to assist the clinician and to be a consistent advocate for the patient. After the procedure is complete, I assist the patient in dressing and ensure they are comfortable before leaving the room. By upholding these practices, I am not just following protocol, I'm actively building a foundation of trust and respect, which is essential for providing high-quality, patient-centered care, especially in sensitive clinical settings.
Describe a time you had to deal with a difficult patient or family member. How did you handle the situation?
It's not uncommon to encounter difficult situations in nursing, and I recall a time when I cared for a patient who was becoming increasingly frustrated with her lack of progress after surgery, which led to her family members becoming quite demanding and upset with the nursing staff. The patient's daughter was insistent that her mother wasn't receiving the proper attention and began to raise her voice, creating a stressful environment for everyone on the ward. My approach was to immediately de-escalate the situation by moving the conversation to a private area away from other patients. I started by using an empathetic and calm tone, acknowledging her feelings. I said something like, "I can see how worried and frustrated you are about your mother, and I want to assure you that we are doing everything we can." I then listened attentively without interruption, allowing her to voice all of her concerns. After she had finished, I summarized her key points to show that I had heard and understood her. Then I provided clear, factual updates on her mother's condition and explained our current care plan in detail, highlighting the purpose behind each intervention. I also offered to facilitate a meeting with the charge nurse and the physician to discuss her concerns further, which made her feel heard and respected. The daughter's demeanor changed completely once she felt that her concerns were being taken seriously and that she was part of the care team, not an adversary. This experience reinforced for me the importance of active listening, maintaining a calm presence, and providing clear communication to build trust and resolve conflict effectively.
What methods would you use to educate a young patient about safe sex and contraception?
When educating a young patient about safe sex and contraception, my approach is centered on creating a non-judgmental, confidential, and comfortable environment. My first step would be to build rapport by asking open-ended questions about their current understanding and any concerns they might have. This helps me tailor the information to their specific needs and avoids making assumptions. Rather than just lecturing, I use a conversational style, treating the discussion as a collaborative effort to ensure their health and safety. For a topic as sensitive as this, I would use clear, simple language and avoid medical jargon. I would start by explaining the basics of sexually transmitted infections, emphasizing that safe sex isn't just about preventing pregnancy, but also protecting against diseases. I would use visual aids like models of male and female anatomy or diagrams showing how different contraception methods work. I would describe various options, including hormonal methods, barrier methods like condoms, and long-acting reversible contraception, highlighting the pros and cons of each. I would specifically focus on correct and consistent condom use as the primary method for preventing STIs. I would also discuss how to acquire these methods and where to go for further support. Throughout the conversation, I would repeatedly stress the importance of open communication with partners and emphasize that they have the right to make informed decisions about their own body. My ultimate goal is to empower the young patient with the knowledge and confidence to protect themselves and to feel comfortable returning with any future questions or concerns.
How do you stay updated on the latest gynecological practices and research?
Staying updated on the latest gynecological practices and research is a professional obligation and something I take very seriously to ensure I'm providing the safest and most effective care. My approach is multifaceted, combining formal learning with daily practice. I make it a priority to regularly read reputable gynecology journals and publications, such as the British Journal of Obstetrics and Gynaecology or resources from the American College of Obstetricians and Gynecologists. These sources provide evidence-based research and clinical guidelines that directly influence best practice. Beyond reading, I actively seek out continuing professional development opportunities. This includes attending webinars, seminars, and hospital-based grand rounds that focus on emerging topics like new surgical techniques, advancements in fertility treatments, or updated management protocols for conditions like polycystic ovary syndrome. In my daily practice, I ensure I am an active participant in team discussions and debriefs. These sessions are excellent for sharing knowledge and learning from the experiences of colleagues, consultants, and specialists. I also make it a habit to review and understand any new hospital policies or protocols related to gynecology, as these are often implemented to reflect the most current research. This consistent effort to stay informed is driven by the understanding that a well-informed nurse is a better advocate for her patients, ensuring they receive care that is not just routine, but truly at the international standard. My commitment to ongoing education is not merely about ticking a box. It is about providing the highest quality of compassionate and knowledgeable care.
Describe your experience working in a multidisciplinary team.
My experience working in a multidisciplinary team has been extensive, and I believe it is essential for providing holistic, patient-centered care, especially in a complex field like gynecology. In my previous role, I was a core member of a team that included gynecologists, midwives, oncologists, physical therapists, and social workers. We collaborated on a daily basis to develop and implement comprehensive care plans for patients with a wide range of conditions, from high-risk pregnancies to gynecological cancers. For example, when caring for a patient undergoing treatment for cervical cancer, I worked closely with the oncologist to manage her chemotherapy side effects, while also communicating with a social worker to address her emotional distress and help coordinate financial support. My role was to act as the central point of contact, ensuring that information was shared accurately and efficiently between all team members. I would attend daily huddles to provide updates on my patient's progress and to receive input from the different specialists. This collaborative approach allowed us to address every aspect of a patient's well-being, not just their immediate medical needs. I learned to value each team member's expertise and to communicate clearly and respectfully, even during high-pressure situations. This experience has taught me that the best patient outcomes are achieved when all members of the healthcare team work cohesively, sharing a common goal and leveraging their unique skills to provide coordinated and compassionate care. Ultimately, a strong multidisciplinary team creates a safety net for the patient, ensuring no detail is overlooked and that care is truly integrated.
What qualities do you believe are essential for a gynecology nurse?
Empathy and excellent communication skills are arguably the most essential qualities for a gynecology nurse. Patients in this field are often at their most vulnerable, dealing with sensitive topics like infertility, gynecological cancers, or intimate examinations. A truly effective nurse must be able to put herself in the patient's shoes, offering a non-judgmental and compassionate presence that helps them feel safe and respected. This empathy, coupled with strong communication skills, allows me to explain complex medical information clearly and patiently, and to listen actively to a patient's concerns, ensuring they feel heard and understood. Attention to detail is another crucial quality. From accurately documenting a patient's symptoms and history to carefully monitoring vital signs and surgical incisions, a gynecology nurse must be meticulous. This is especially important in a field where subtle changes can indicate a significant complication, such as a post-operative hemorrhage or a developing infection. My vigilance ensures that I can identify potential issues early and escalate them to the medical team, safeguarding the patient's well-being. Finally, discretion and professionalism are paramount. Given the private nature of gynecological care, a nurse must be a trusted professional who upholds strict confidentiality at all times. Patients must have full confidence that their personal and medical information will be handled with the utmost respect. I believe these qualities, empathy, communication, attention to detail, and commitment to professionalism, form the foundation of providing excellent, patient-centered care in gynecology.